Hello everybody, I hope you guys are doing well. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. Let's talk about Piriformis syndrome treatments. Well, first, what is Piriformis syndrome? So we have several videos on our YouTube channel, Facebook page, Total Performance Physical Therapy, that will tell you all about this in more depth than what I'm about ready to go into. So if you have further questions about exactly what it is, you can look on those channels and we will address exactly what it is. But what is Piriformis syndrome? It is basically literally a pain in the butt. So if you're somebody that goes, I have a pain right here, you're looking at Piriformis syndrome. Now, it's not to be confused with if you have a pain up here, more up towards your hip. That is something called your SI joint. Not what we're going to talk about tonight. Tonight we're going to talk about really just a pain kind of in that lower butt area. Very painful to sit a lot of times. Can be kind of relieved with standing. Walking sometimes makes it feel better if it's not really tight, or there's not multiple things going on. Driving tends to drive, no pun intended, the piriformis crazy. So a lot of times you'll get a lot of increased symptoms when you're driving, when you have that piriformis syndrome. Now, it can literally be just a pain in the butt. It can start as a pain in the butt and run all the way down your leg. It can make kind of pushing that gas and brake pedal very painful. It can be just something that runs into the mid-thigh, behind the knee. So, but normally anytime there is some type of piriformis syndrome going on, you're going to have a literal pain in the butt. So let's talk about what we do for that. There are a couple stretches that you can do. First one is the figure 4. So I'm going to show you 2 ways of doing the figure 4. So this is an easy one to casually sit at your desk and do. I'm obviously on an elevated table, but you really would preferably have that other foot flat on the floor. Sit up nice and tall and then bend forward. What you don't want to do is you don't want to do this and then collapse forward. You're just herniating your discs. You're just causing yourself more problems. So you want to make sure you're sitting up nice and straight and you're hinging forward at the hips. You want to stop when you feel a gentle stretch. You could feel a stretch in the back, in the hip, in the back of the leg. Wherever you feel that stretch, you want to stop. You want to make sure that you feel a good stretch but not pain. You should not feel any burning. It shouldn't be intolerable. So you want to be able to hold that for 30 seconds, 6 times. Now, as you're sitting here and you're leaning forward and you're stretching, you may be able to go a little bit further. So that's okay. But again, when you're moving forward, you just want to make sure that you are hinging from the hips and not slumping over. The next stretch I'm going to show you is pretty much the same one, but it can get a little bit deeper than what we just did. Is you're just going to prop your foot up on a table, counter, something. Again, stand up nice and straight. This may be enough of a stretch, and that's totally fine. If it's not, you want to lean forward again at the hips until you feel a gentle stretch. You're not here. You're not slumped over. Lean forward nice and easy with that stretch and that nice straight back that you want to have. Feeling a stretch in through your butt area, maybe into your hamstring, maybe into the back of the knee, the side of the leg. Again, stopping when you feel that stretch. That's a gentle stretch. Finally, you want to really kind of get in there and dig at it. This is a beastie ball that we use here. You can have a tennis ball, a golf ball. You want to be careful though as you dig into it because you can make yourself really sore. So only do this 2 or 3 minutes and then stop. It depends on how tight that piriformis is. Will depend on how you can do this. You can stand up against the wall and do this. You can sit on this and just roll it around. This is more aggressive than anything. If you can't feel it then, you can actually do that stretch that I just showed you and then roll it around. That'll really get in there deep. Again, just a couple of minutes. Once you get used to this, once you do it a couple of minutes and then, the next day you don't really have any residual soreness or pain, you can do it 2 times a day, you can do it 3 times a day, but gradually work your way up. Don't just sit on this for 10 minutes and expect to get it out and really try to get it out. You're actually going to make yourself more sore. And piriformis syndrome is a result of compensation. So if you make yourself more sore, you're going to just wind up compensating for that and causing yourself even more problems. And then after this, you do want to put some ice on there just to calm everything down, making sure that that inflammation isn't too much so you're going to start limping or causing you any more problems. If you or someone you know is suffering with piriformis syndrome and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215 997-9898, and we'd be happy to get you in. Thanks, and have a good night.